So thank you very much and good morning to you all. I think Dr. Doku has made my work quite easy. He set the platform for what I'm going to talk about, which is fatty liver disease. I'm sure most of you have been to the hospital where you did an ultrasound, they said fatty liver disease, and you're not sure what to do, whether to stop eating fat or to continue. He's also made some very interesting points, especially when it comes to sexual health and why people get excited. It has a very important cardiovascular significance. It's been shown that those who have erectile dysfunction, they have a higher risk of going through to see Dr. Doku at the cardiovascular area. So it's important that when it comes out, you wake up, and we all try and support that talk as well. I think science is very interesting, and I just want to share this conclusion from science with you. All right. After my presentation, maybe we can have a debate on it. I'm just reading it. What? So it says, scientists tested a frog. They cut his leg off and said, jump. The frog didn't jump. Scientists therefore concluded that when frogs lose their legs, they become deaf. I think that's very interesting. And I can actually see, all right. So that's what makes it quite interesting. And I'm sure the lawyers, you are thinking through it, analyzing all over. Right, so the objective for my presentation today is to empower the legal practitioner to make informed health decisions when it comes to fatty liver disease. In other words, when you are diagnosed of having a fatty liver disease, what is the next point? So I'm going to follow these outline, very brief. When I was preparing the slide, I was thinking of my learned colleagues. Should I pitch it high as opposed to speaking to the general public or not? So I had a bit of a challenge, but we'll be able to still communicate. I am not in the legal profession, but these are other group, which I will say. So what is fatty liver disease? At least by the time you leave here, you should know what fatty liver disease is. What are some of the causes? How common is fatty liver disease? How is it diagnosed? What is the clinical implication, and what therapeutic options do we have available for you? So it's very simple here. We have some amount of fat in the liver, but it's not a problem. Only when the fat level in the liver goes beyond 10%. So 5 to 10% is allowed, and that is not a problem. But anything beyond this is what you are diagnosed with as having fatty liver disease. So today, you can go home with a term called steatosis. Steatosis, which means fatty deposition in the liver. That's all it means, okay? So that's what fatty liver disease is. So when you go and do an ultrasound or any imaging, they'll say they saw that you have fat in the liver. What is the next step? What I would also want to say is, what are some of the causes of fatty liver disease? So that you know that some of them you may be causing it, and just by stopping some medications or modifying it, it would reverse. The number one is excess alcohol. We'll talk about what excess alcohol is. I'm sure it's always been a debate. What is excess alcohol? What is adequate alcohol? We'll try and explain that to you. So when you are taking a lot of alcohol, you have fat deposition in your liver, and that is what sets the process of scarring in the liver, and finally the liver actually failing. So that's the number one thing I want to talk about. But once you are taking alcohol and you have fatty liver, it's not surprising. When you see the doctor, they know what to tell you. Stop, and it will stop, right? So that's not a big deal. But those that are not related to that are the ones I'm going to focus on. Again, obesity, I was very happy to hear Dr. Doku talked about the BMI. They do the weight, height, and all that. And I'm sure when that is done, they will tell you whether you are overweight, obese, moderately, or even morbidly obese. And this obesity is actually also a risk factor for fatty liver disease. And again, he talked about cholesterol issues. So your dyslipidemias or fat, should I say, inappropriate levels in the blood is also a risk factor for the fatty liver that we're talking about here. What is also important is rapid weight loss. So you don't want to lose more than 10 kg in a month. It would affect your liver. So it's a gradual weight loss process. I'm sure when you see the physicians and then we talk about, nobody says you have to lose weight in 1 week or 2 weeks, gradual. When you lose suddenly, you can actually develop this fatty liver. And some actually have gone on to develop liver failure, getting to the extent of actually needing a liver transplantation. So rapid weight loss can also do that. Some also have just the genetic predisposition, And so in that case, you need to know, visit the hospital. Don't wait until you even have the fatty liver disease. Once you know the genetic predisposition is there. Some of them are as a result of side effect of some medications or medicines. So be aware of that. The medication that you are taking, can it cause fatty liver disease? So that just in case it comes up, you can actually stop or go for other alternatives that can address the same problem for you. Too much iron in the body, we call it hemochromatosis, can also be a reason why you have fatty liver disease. All I'm trying to say here is that, and then hepatitis C. I was happy to hear Dr. Doku talked about the fact that you're also doing hepatitis C testing here. And the good news about hepatitis C is that it's curable. 12 weeks of oral medication and you have a cure. And so your fatty liver can actually be reversed or cured, if you want to put it that way. So if you are positive, don't be scared at all. Fortunately, there is a cure for this. I went through all these lists just for you to know that fatty liver is caused by many things. And so if you have it, we need to get to the root of why you have the fatty liver, and then it's addressed. So we classify them broadly as alcoholic and non-alcoholic. And I said, once we say alcoholic, significant alcohol intake. I will try and define that for you using some practical example as we go along. But the focus is going to be on the non-alcoholic fatty liver disease. Because you know you are not taking alcohol, all that, you go to the hospital and they say you have a fatty liver. What do you do? I think that's a lot of the talk is going to focus on that. But the alcohol part, I think I've told you, the best medication is to stop or reduce the consumption. And then you will be followed up by your doctor. I'm sure some people are not happy about this recommendation. And sometimes you go to the hospital and the doctor gives some counseling, because you are supposed to make the choice. And then the patient will ask you, Doc, you think this is possible? And the doctor will say, do as I say, don't do as I do. Sometimes you may meet the doctor crying, he's taking more alcohol than you. Right. So we'll focus more on the non-alcoholic fatty liver disease. And what is that? So we're just talking about fatty liver disease in the absence of significant alcohol intake and other common causes of steatosis. So today we've learned steatosis, fat deposition in the liver. So in the absence of alcohol intake, and that's what we are going to focus on, because the alcohol part is a whole topic on its own, and like I said, it's a modification of your consumption. And this is the interesting part when it comes to alcohol, how much of alcohol is good. And I'm just showing this cartoon here, and you see the gentleman in here, he's saying that my doctor said only 1 glass of alcohol a day. I can live with it. And I'm sure this glass is more than 2 bottles, is that not? So that's how people define it when you tell someone, oh, you can just take maybe 1 bottle and you don't go deep to define it, they satisfy themselves by saying that this is the doctor's recommendation. But what has been shown is that if you take more than 40 grams of alcohol a week, it's considered significant alcohol intake. Some books even bring it to 30 grams. But I think let's look at 40, because it looks like alcohol is very important. So, so instead of reducing the threshold, I've moved it up a bit. So 40 grams of alcohol a week. What does that mean in simple terms? Maybe somebody should tell me the percentage of beer. Let's assume, just for the mathematics to make it easy, let's say beer is 10%, right? Hey, there are officers here. I wanted to test the officers here. and I got the right response. 5%. Right, 5% will make the calculation a little bit more complicated. So let's say 10, okay? So that is not real, but you understand. Then you apply to what you drink. So 10%. Anytime you say 10%, what it means is that 10 grams in 100 mils. And the beer bottle is 600 mils, right? I think that one I got it right. 600 mils. Officers? that is impressive. Yeah, they've actually given me the 25 on top of it, so it's 625. But let's assume it's 600 for the calculation purposes. So when you say 10%, it means 10 grams in 100 mils. And then you have 600 mils. So it means 1 beer bottle in that sense give you 60 grams. So we can go back to the 50, to the 5%. So if we go back to the 5%, what it means is that 1 beer bottle will give you 30 grams of alcohol. It means you don't have to take more than 1 bottle a week. So if you're doing anything less than 1 beer bottle a week, you are good to go. which is simply impossible. Is that right? Okay. Right. But that's the doctor says, do what I say. Good. So we'll go to the next aspect. So for this fatty liver disease, it's not everyone who would meet the first time and has only fat in the liver. There are those who will come at the last spectrum of the disease, so they have irreversible scarring, which we call cirrhosis. And you cannot change it. You can only manage it, or a liver transplant as an option. But there are those who would come in early, and that's the essence of screening. That's the activity that my boss, Dr. Doku, has been doing for years now, to get in early. Because if we see and you have steatosis, there's no problem. A lot can be done about it. And it will progress through the steatosis with inflammation of the liver, which continues through all the way to the end where you have the scarring. So these fatty liver patients may come in at any of these stages. And please, we want to see you at steatosis and not at cirrhosis, okay, where we cannot do too much for you. Okay, so if we look at the slide here, the first image is showing the beautiful liver here with well-defined area. The middle one is talking about the fat infiltration. And then this is what we call cirrhosis, the last but one up there. And there's scarring, nodularity of the liver. And usually this is irreversible. Okay? We have some evidence of hepatitis B associated with this, where you treat and you have some reversibility. But most of liver cirrhosis that you see is irreversible. And this is also a risk factor for liver cancer. And I understand last year you got a very excellent education on liver cancer, so you know what it's about, what it entails. So others may actually go ahead to have liver cancer as part of this disease development. And like Dr. Doku said, the death is not sometimes even directly from the liver, but from the heart and other related structures. So we say this fatty liver is actually it's a hepatic manifestation of metabolic syndrome. And today, Dr. Doku talked about metabolic syndrome. It's a patient who has hypertension, diabetes, obese. Together, we call it metabolic syndrome. And anybody who has this metabolic syndrome, one of the manifestations is actually fatty liver deposition, steatosis, which we've talked about. So it's an important discussion for today, zooming in nicely on the cardiovascular aspect as well. I say that the importance of any disease is determined by these two things, the prevalence. So if it's 0.00%, I'm sure you'll be saying, oh, it's unlikely it will be me. But what we say in statistics is that when it's 1 out of a million, it's what? 160,000,000. But if it's you, it's 100%. Is that not? If it's somebody else, you can quote and say 0.0001. So, right. So if it has a high prevalence, then everybody is worried about it. Like the COVID issue, it was so much all over the place, and so everybody was worried about it. And then the natural history. So natural history is that if I have this particular condition and nothing is done about it, how is it going to progress? Are there treatment options to change the direction that it will go to? Right. So we're looking at fatty liver across the world. What is the data like? And in Africa, we are looking at about 13%. In other places, you can see it quite high up there. And we're corresponding that with the caloric intake, the average caloric intake of the population in there. So let's say even in our country, we say 13%. And in our study, we looked at about 11%. Among those patients who have diabetes, the fatty liver is even higher. So 13%, let's reduce it to 10. So we say 1 in 10 have fatty liver. That's quite significant. So project it to over 30 million people. That's quite a significant number of people that we need to deal with. So why study it? The prevalence is very high, 13 to 32%. It's the leading cause of cryptogenic cirrhosis. In other words, people come to the hospital, they have scarred liver or cirrhosis, and we do not have a reason for it. We screen for all the known causes. And usually it's actually as a result of fatty liver disease. And that's why it's important we address it. It affects everyone, all age groups, ethnic groups, everyone else is also affected. And more importantly, more females are affected. And you know the ladies are very precious to us, so we are very interested in liver disease as well. It's also important because of the obesity epidemic, and I'm sure when you go to Dr. Doko finally, Dr. Niaja and the team, they will talk to you about your BMI and the significance. So for those who have obesity, fatty liver is higher amongst them, and therefore you need to address it. That's the data that I'm just trying to show. Depending on the degree of obesity, the fatty liver prevalence is higher and has to be addressed. And what I just want to say is that we always focus a little bit on obesity, but there are those groups we call them TOFI, as in TOFI. So thin on the outside, fat inside. I'm sure you're thinking, what is that? So you go home today with TOFI. And they also have the metabolic syndrome. So don't just think about those who are overweight and all that, but we need to focus on that. So Doku is doing the cholesterol and all that, irrespective of your size, to be able to address that part of it. A genetic predisposition, I think we've talked about that. You know, it's a family something. Don't wait until you have it. You see a doctor early and go through the process. Sorry about that. Apart from the liver, I've been given information that it's a fatty ripple. Okay. Right. So apart from the liver, which is the focus for today, having fatty liver has some extra hepatic manifestation. It means some manifestation outside the liver. And here, we're looking at colorectal cancer, very important here, hypothyroidism, bone disease we call osteoporosis, sleep apnea, chronic kidney disease, cardiovascular disease. So it has a central point that if you get into that, we'll look out for all the other possible things that can also come in and make sure they are well corrected. Symptoms to look out for. I'm sure by the time we leave here, all of you would want to go and see if you have fatty liver disease. Given the symptoms we see here, tiredness, fatigue. What it means is that, it looks like, when you work, you get tired. Is that not? So you may not necessarily have fatty liver, but those who have fatty liver, more of them actually present with this. I'll just show a slide here, which talks about the commonest presentation. It's actually fatigue. So it will be important that we all go check and see, and that we can address it properly. Quite a significant number of people are also asymptomatic. They don't have any complaint. And then those who have, we say, right quadrant pain. So on the right side of your abdomen, up here, well, that's what we call right upper quadrant. Okay, so right side of, if you have this pain lingering on for a while, it will be important to see a doctor, to have an ultrasound done to be sure it's not a fatty liver. We don't want to see you coming in with all the swelling and the bleeding issues. That's usually very advanced, and that's not our focus of interest today. In terms of diagnosis, there are many options, and all of you here I know can afford that. So please don't wait. From abdominal ultrasound, fibroscan, and these are all available in Ghana, which you can actually do to determine whether you have a fatty liver or not. So maybe after this conference, Dr. Doko and the team would put together something for you to be able to assess that. What are the treatment options? I'm not going to focus on the medicines, but the options for you to know. Number one is physical activity. So some form of exercise will be a good idea, but it's been shown that exercise alone has a limit. It's able to reduce fat, but it's not able to go further. Dietary modification, which is one of the most difficult things, because the key restriction here is about carbohydrate restriction, and all of us will eat some fufu rice with some small meat on the side. The dietitian would actually come in with the proper advice for you. But not to stop carbohydrate completely, but reduce the portion is one of the key things when it comes to dietary modification. I will not attempt to give the prescription here, but you would follow through a protocol with appropriate dietitian on that. And then finally, weight loss, which is very key to the recovery from fatty liver disease, and even those who have some inflammation in the liver from fatty liver. If you're able to reduce your weight, you're able to get very good outcomes. Is my slide changing now? I should point it downward. Oh, okay. So there are many weight loss strategies that can be discussed. So we're looking at dietary modification, as I said. If you're able to restrict carbohydrate, you can lose very good amount of weight. So when I stop taking some sugars and all that within a month, this my little pot belly here disappears. So I know it works, and I have many patients who've also had that as well. Exercise, which we talked about. Some bariatric surgery makes a lot of difference, depending on the level and the risk. It can be discussed. And then you can also have what is called intragastric balloon placement. So very simple surgery, you put a balloon into your stomach. So for us, the stomach is actually inside, not this one. When we say stomach, there's a sac in there. That's the stomach in there. And that would help you reduce some weight as well. So there are many options, and as you come in, we can advise you appropriately based on your level and the need for weight loss associated with your presentation. So what is my take-home message on fatty liver? Number one is that if you have symptoms, any of the things we've talked about, you need to see your doctor. Number two, it will be preferred to see the doctor when you don't have any symptoms, what we call screening, what the team here is doing. Just walk in and check to see if you have fatty liver so that something can be done for you. Diagnosis of fatty liver requires a follow-up. So if you go anywhere and you get a diagnosis of fatty liver, you cannot just be reassured that, oh, it's just fat in the liver and it's nothing. And that's why I say empowering you to make that informed health decision on fatty liver as well. There are many therapeutic options for you. We did not discuss the medicines, but we have experts available who can take you through these processes. And my final message is that you need to get the right doctor to help you as well. Thank you very much.